It has been just under 1 month since President Donald Trump took office, and it's become clear that one of his administration's early priorities is significantly shrinking the federal workforce. In recent weeks, several government agencies have been impacted by this initiative. So far, we've seen more than 1,000 employees at the Department of Veterans Affairs dismissed, 3,400 from the U.S. Forest Service, and just this past weekend, 300 workers with the Federal Aviation Administration lost their jobs. Just over 400 people were reportedly cut at Homeland Security, including more than 200 at the Federal Emergency Management Agency and at least 130 with the Cybersecurity and Infrastructure Security Agency. In addition to those layoffs, an unspecified number of workers at the National Nuclear Security Administration, which is part of the Department of Energy, were let go late last week. The NNSA is responsible for overseeing the nation's nuclear stockpile. However, officials with the Trump administration reportedly tried to contact those employees to inform them their firing was being rescinded, but now no longer have a way to contact them. These mass layoffs don't just affect workers in Washington, D.C. They reach government workers all around the country, including here in Maine. News Center Maine's Caroline LaCour sits down with one former federal employee of the Substance Abuse and Mental Health Services Administration. That's an agency within the Department of Health and Human Services.
There's this sort of stereotype that's out there about federal workers, and we're just drawing a paycheck, we're not doing anything. Come on, I'm just a normal Mainer. I'm trying to help other Mainers.
For the past 8 months, Scott Gagnon has served as a regional director of the Substance Abuse and Mental Health Services Administration, connecting people in Maine to crucial resources from the federal government, a position he took pride in.
I was specifically recruited to apply for this job because of my knowledge, skills, and abilities. I received a national award while I was in this position for addiction prevention.
Despite his abilities and that award, Gagnon was let go this weekend, along with thousands of other federal employees of the U.S. Department of Health and Human Services. Most were on probation, which is standard for newly hired federal workers.
We did this to serve our fellow people in our regions, and to not be able to do that now it's heartbreaking.
He says it's not just heartbreaking for his team at SAMHSA, but also to people across New England who depend on them to access vital services.
Including the ones that I'm responsible for, mental health and addiction. There'll be real impacts felt.
Before he was laid off, one of Gagnon's responsibilities was to support the Maine crisis line 988. Leaders of the Opportunity Alliance, who help manage the line, tell News Center Maine changes to the programs would be detrimental to clients and also disrupt dozens of staff members. In a statement to News Center Maine, Congresswoman Shelley Pingree calls the firing of HHS employees in part incredibly alarming, adding from collecting data and developing best practices to supporting community prevention programs, our federal health agencies have a vital role to play in helping us better understand the significant mental health crises facing our country and how to effectively address them. As for Scott Gagnon,
I am a mission-driven person. I took this job to serve in the fields of behavioral health and addiction, and so I will find a way to continue doing that.
In Gray, Caroline LaCour, News Center Maine.
Senator Susan Collins, a Republican, also expressing concern regarding the impacts of the layoffs and issued the following statement saying, quote, "The sweeping and indiscriminate firing of probationary employees at HHS could lead to confusion and difficulties for patients and providers who rely on the essential programs of the department."